Gloria, hi. Thanks ever so much for joining us on PhocusWire's first Pulse event. I think a very important person. Oh, you're very welcome. I think a very important person to have to kind of kick things off for us today, just because WTTC is a very prominent organization in the way the industry operates. It's a commercial organization, has lots of industry members. But we thought it would be good to talk to you, first of all, to just kind of give us a really good overview of where the industry is at the moment and some of the work that you've been doing behind the scenes, both publicly and privately, to get things going again, and then kind of dive into some of the issues there. So first of all, I mean, just briefly, if you can, Gloria, just kind of give us a sense of where the industry is now, the impact of the last 12 months on it, maybe some figures that you can give us, impact on GDP, all those kind of things, first of all.
Well, thank you for having me. As we know, WTTC was created 30 years ago to quantify the economic impact of our sector. In 2019, when we released our numbers, we published that 10% of the global GDP, that was the contribution of travel and tourism, 330 million jobs around the world, which is 1 in 10 dependent on travel and tourism globally. As you mentioned, this was the worst crisis ever. Just to give you an idea, the global impact as of the end of 2020, it was estimated to be 174 million jobs impacted globally and $4.5 trillion or $4,500 billion. So that is totally unprecedented. And when we say jobs impacted, that includes jobs lost, or that includes jobs in furlough that might be lost in the near term. 80% are SMEs. And of course, as we know, 54% in our sector, women, 30% youth. So it has been devastating for everyone.
Okay. So the figures that we've heard a lot, and as you say, they're devastating, and we're not really quite sure really how the next few months are going to unravel. However, there must be some kind of planning in terms of recovery scenarios that you are working through at the moment as an organization and with your member companies. Can you talk us through some of those?
Yes, you're absolutely right. We estimated a couple of scenarios, and according to those scenarios, this year we can bring back between 88 million jobs and 111. So it's an average of 100 million jobs out of the 174 already impacted. But in order to bring back those jobs, certain conditions, they need to happen. And that's why the advocacy work that we do with governments is crucial, because we speak with one voice and we're trying to work with governments to implement the policies that are needed to resume mobility, especially international mobility that is related to international travel. If we have the policies in place that they are required, we believe that we can have a strong recovery starting in April, and of course, a strong summer, as long as we have this collaboration that is needed among countries and also with the private sector.
Certainly where I am here in the UK, there's been a lot of excitement. I think you're based in here in the UK as well, aren't you? There's been a lot of excitement over the last 24 hours about, the end of lockdown, and here's the time to start thinking about your summer holidays. I believe, Gloria, it was back in either September or October, there was WTTC was saying that it was close to having some kind of coordinated efforts amongst your members and governments, whether that was multiple numbers of governments. Can you give us a kind of an update on what that collaboration has come to yet, or what your kind of vision is for that?
Yes, back in October, we had the chance to participate in the G20. This was the first time ever that the private sector is invited to join to this platform. WTTC has been participating for years, but never we had CEOs to be part of this session. Why the importance of the G20? Because when you look at these 20 countries, it's very complicated to get the international collaboration in 100 and plus countries around the world. But at least if we can get these 20, that will cover for a big portion of the world, and it will be a domino effect. So we presented in this very important meeting a plan that it was requested by Saudi Arabia. Saudi Arabia, by the way, was the presidency of the G20 last year. We presented a plan to recover 100 million jobs that included 12 commitments from the private sector that we have executed so far, and 12 things that we needed from the governments. Some governments have been very proactive and accomplished and executed all the 12 commitments, but unfortunately not all of the governments. So we're a little bit behind in that plan. We created a task force where our CEOs meet frequently and review the progress. And some of the things, for instance, that we still have to work on is the interoperability on the digital apps that we have around the world for the digital passes, as an example. Right now, we have so many solutions that they don't talk to each other, and that creates more problems with government. So we need to have that framework and interoperability that is needed. But overall, we are feeling more comfortable, more confident. We're finally moving in the right direction. We're also working with governments in Europe, the G7, of course, and also OECD that is helping us for the protocols needed for the mobility. And when I say protocols, are the rules, so that we can have certainty next time that you travel out of London, you know exactly what's expected from you, depending on the country that you're visiting, and also what's needed in your way back.
Would you say, finally, on this kind of the government collaboration question, would you say it's been an easy task, if such a thing can be an easy task, but by which I mean, you know, coordination and even just getting access to the right people, and indeed coming up with a unified voice, or has it been quite challenging? Because I would imagine many countries have got maybe different scenarios of their own that they want to kind of work through in this kind of recovery period.
That is a great question, Kevin. And the reality is that a WTTC crisis has been a priority since I recall. And we analyze a lot of situations, 90 situations in the last 20 years to learn from the past. And I can tell you without a doubt that the biggest challenge that we had last year was the lack of, or the poor coordination among countries, the lack of sharing of best practices, the lack of interaction. Every country, for obvious reason, was looking just for their own citizens, which we understand. But at the same time, when someone else is doing a better job in a specific area, there's an opportunity to do best practice sharing. We have tried to cover the gap, sharing some policies from some countries to others. But I can tell you the greatest challenge has been the lack of international collaboration, and that has slowed the recovery, that has impacted the outbreak. And of course, because countries were doing different things and trying to test as they went. And I don't blame them, because there were a lot of unknowns, but at the same time, we didn't have that leadership needed to step up and try to bring that coordination. And that's what the G20 was, a crucial platform for us.
Gloria, can we talk about COVID passports? There's, you know, I don't want to continue bringing up what's going on at a political level here in the UK, but obviously it's obviously front of mind. I mean, there's some considerable debate here about the COVID passports, or and how that might work. I mean, do you have a WTTC view, or how you see that kind of playing out?
We do, and that's another great question, because there is a lot of confusion between a passport and a pass. And let me just clarify that, and I'll tell you what's the position from WTTC. First of all, a health passport includes all your information, all your vaccinations, including chickenpox, whatever vaccinations you have had through your life. We don't believe that health passports are needed to travel. Now, in the case of COVID, we need digital passes or health passes that sometimes are confused with passports. A health pass is just for one time. That could be a health pass for a test in case that you needed a test to travel. The health pass in a digital app would say that you tested negative or positive and you're not allowed to travel. Now, if you have a vaccine, hopefully in the future, the health pass will say that you have been vaccinated. However, that doesn't seem that is going to be the only requirement, because more and more the public health experts are telling us that you can be vaccinated, but that doesn't guarantee that you're not spreading the virus. So we need to be very careful there also, and thinking that requesting vaccination as a requirement to travel is enough. We are not in favor of vaccination as a requirement. We believe that, yes, vaccination is great. The UK has done an amazing job in the rollout, and also many countries in Europe and North America. But at the same time, we need to very aggressive continue with testing, low-cost tests with high efficacy, so that we can make the invisible visible and isolate the people infected, so that we can resume mobility and have this seamless and safe experience.
Where do you, as you may have heard in my introduction there, we've got a professor of vaccinology coming up in about an hour, who's very heavily involved in antibody testing as a mechanism for, rather than a vaccine passport or a stamp like that. I mean, where do you sit on something on, do you see that as part of the testing requirement that you just referenced, or do you see that as something else? So it's antibody testing.
Well, according to the conversations, and we work with so many experts around the world, including CDC, WHO, and of course, Harvard School of Public Health. And my understanding is that antibody test is not enough. We need to be able to know if you have COVID or yes or not. An antibody will tell me if you had past tense COVID, right? And if you had the antibodies. Now, that being said, there are some cases of people that have had COVID twice or 3 times. So from our perspective, as I said before, we need to be able to identify the people infected. And this is a lesson from the past. We were able to travel after SARS, after Ebola without a vaccine, because we were able in the past to isolate the people infected. Yes, here we have a lot of asymptomatics, and that's why testing is crucial. But in our mind, it's testing for COVID. If you're sick, if you have COVID, you should not be allowed to travel. And in that case, you should be sent to quarantine. However, if you're healthy, you don't have COVID, you should have your freedom, you should have the mobility and clear rules in order for you, your loved ones, your friends to be able to move around and travel around the world with the guarantee that who is traveling with you in the same flight or the same train has also tested negative. So we can include testing as part of the seamless and safe experience before departure, and testing for the virus, not for the antibodies. That's what the experts are telling us.
Okay. Again, recently in the UK, just a week ago, which seems quite strange given that we are almost a year into this, we had a quarantine system for arrivals here put in place in the UK. I mean, that's a fairly uncoordinated pattern. So some countries do have the quarantine system in place and some others don't. What's the kind of perspective that you have on that? Because it does seem like that kind of uncoordinated program or very random program around different countries is perhaps not conducive to some kind of wholesale effort to get the industry moving again. Would you agree?
I totally agree. The quarantines are assuming, for instance, the quarantines that we have here in the UK are assuming that everyone is infected. And yes, you might have 100 people arriving and only one tested positive. You should put that individual in quarantine, but not the other 99. There is not enough evidence that the quarantines work and they impact mobility. So I think it's cheaper to invest in testing, contact tracing, and use the technology to isolate people infected. There's a lot of technology and solutions available. I have seen some solutions where you can use your phone, for instance, to download an app to detect through your voice if someone has COVID or not. There are solutions where you go through a screening and they check the airborne particles and they know that you have COVID or not. There's so many solutions out there, and it's cheaper to invest in those solutions in order to resume mobility. Now, that being said, the quarantines are pretty much saying you are not welcome to the country. And for the countries that have imposed quarantines, for the countries that have impacted mobility, those are the countries that last year they had the greater loss in GDP. And there are a lot of examples of countries that have got this better or right, and the countries that have done it, like the hotel quarantines that honestly, I don't see a clear exit strategy, and the impact is significant, and the livelihoods impacted have been significant.
You said something right at the beginning of our conversation, Gloria. You were talking about the interoperability of all the different mobile applications, and you referenced a range of different technologies. The interoperability of this is going to be key, but also perhaps the biggest challenge. So how does the industry or WTTC help kind of either coordinate or get over this hurdle around interoperability?
There are a lot of great applications that have been developed, and currently we're championing an initiative where we're working with all. You have, for instance, the Common Pass that is being championed by the web. You have the IATA Pass. You have the AOK Pass from ICC. There are like 20 different apps. The challenge is, as I say, they don't work together, and that needs to be that's crucial, because governments are going to probably recommend one versus the other. Airlines will recommend one versus the other. And it's going to be a nightmare for the traveler and for governments if we have so many and they don't connect. So there is an initiative in place that we're working with the WEF, with IATA, with ICC and many others, bringing everyone together, IBM, Google, everyone, and of course the GDSs, to create this interoperability and the trusted framework so that it's easier for the consumer, for the traveler, and for the governments. And for you, it's seamless. We need to make it easier for the travelers, but at the same time, be able to show if you tested negative in your app so that it's totally touchless and it's a seamless experience and not more complicated that you need to download 5 or 6 apps in a journey.
Right. And finally, if we can, I mean, we've talked a lot about government collaboration and provision of technology already and various other elements. What would you say, if anything, perhaps you may have identified around these changes and things that are coming in that you might actually see as being long lasting and ultimately beneficial to the kind of the traveling experience, even if, as we hope, this pandemic does kind of go away and things return to normal? What do you think is going to be long lasting for us?
Well, let me just tell you 3 things. First of all, we need to learn to coexist with this virus. If someone is thinking that everything is going to go back to where we were in 2019, that's wrong. We are moving forward with an accelerated digital agenda, accelerated sustainability agenda. We need to think forward. Now, that means that we need to learn to coexist with the virus for some time, which means that some protocols that have been implemented, they'll stay longer. For instance, you will see a lot of screening in airports, like monitors checking your temperature. You will see whenever you go to security, perhaps those kiosks to check right now for explosives, they will be checking for virus as well. You will see some sanitizing procedures in place that they'll stay for good. So you will see some things in your experience overall that will be implemented for long term. Now, are we going to see wearing the mask forever? No, but we will see wearing the mask at least for this year, I have to say. And perhaps for international travel, long haul in the future in some parts of the world. As before COVID, we were seeing that in Asia, who had 11 outbreaks in the past, and they had more experience than, of course, this part of the world. So you will see also a lot of touchless, a lot of use of biometrics, a lot of use of applications to have your data, your information more seamless. As I say, the agenda has been accelerated, and some countries were planning to implement biometrics in 3 to 5 years. Now it seems that if you don't have it, you're in a competitive disadvantage. So you will see more seamless, touchless, accelerated, as I said, that agenda, and some of the protocols will stay. They are not going to go away, and we just have to embrace it and learn to coexist with this and move on and have the mobility that we are all missing.
Yeah, indeed. I remember reading a report last year that said, the acceleration of the digitalization of both culture and business advanced more in 5 months last year than it had done in the previous 5 years. So plenty to think about. Thank you so much for joining us, Gloria Guevara from WTTC. Really appreciate your time. Next up, we're going to hear from how the aviation world is hearing with our speaker from IATA. Gloria, thanks so much ever so again.
Thank you. Thank you, Kevin.